DenTrends, DenTrends.
Hello and welcome back to the DenTrends DenTalk podcast. I'm glad you're joining me for another discussion on modern dentistry and the innovations transforming patient care. Today, we're talking about one of the most significant advancements in restorative dentistry, dental implants, and implant surgery. If you've ever lost a tooth or treated a patient with missing teeth, you know how much tooth loss can impact confidence, chewing ability, speech, and overall quality of life. Fortunately, modern implant dentistry has given us a solution that closely replicates the function and appearance of natural teeth. Dental implants have become the gold standard for replacing missing teeth because they provide excellent stability, long-term durability, and highly predictable results when properly planned and executed. So let's dive in. At its core, a dental implant is designed to replace a missing tooth root. The implant fixture is placed directly into the jawbone, where it serves as a foundation for a crown, bridge, or even a full arch restoration. What makes implants so successful is a remarkable biological process called osseointegration. This is the direct connection between living bone and the implant surface. Over time, the bone grows and bonds around the implant, creating a stable and functional replacement for the natural tooth root. When osseointegration occurs successfully, the implant becomes firmly anchored within the jaw and can withstand normal chewing forces for many years. However, not every patient is an ideal candidate for implant treatment. Successful implant therapy begins with careful patient selection. Certain medical conditions can affect healing and increase the risk of implant complications. Patients with uncontrolled diabetes, severe immune disorders, inadequate bone volume, heavy smoking habits, or a history of radiation therapy involving the jaws may require additional evaluation before treatment. Another important consideration is age. Many people assume implants are not suitable for older adults, but that's actually not true. Healthy, elderly patients can be excellent implant candidates. What matters most is overall health and bone quality, not chronological age. On the other hand, implants are generally delayed in younger patients until jaw growth is complete. Let's talk briefly about implant designs. Historically, dentistry experimented with several implant systems. Subperiosteal implants were positioned on top of the bone beneath the gum tissue. Transosseous implants passed completely through the jawbone. Today, however, the most widely used option is the endosteel implant. These implants are placed directly into bone and are typically designed in a root form shape that closely resembles a natural tooth root. Modern endosteel implants have demonstrated excellent long-term success rates and remain the preferred choice worldwide. Now let's look at the components of a typical implant restoration. The implant fixture is the portion inserted into the bone. Attached to the fixture is the abutment, which serves as the connector between the implant and the final restoration. An abutment screw secures the connection, and finally, the crown replaces the visible portion of the missing tooth. Each component plays a critical role in the overall success of treatment. One of the most important aspects of implant dentistry is surgical planning. Successful implants don't begin in the operating room. They begin during diagnosis. Before surgery, clinicians evaluate bone quality, bone quantity, anatomical structures, bite relationships, and prosthetic requirements. Every detail matters. During implant placement, a precisely controlled osteotomy is created using sequential drilling techniques. Adequate irrigation is extremely important because excessive heat can damage surrounding bone. Research has shown that bone temperatures above approximately 47 degrees Celsius can negatively affect osseointegration and compromise implant success. This is why surgical discipline and proper technique are so important. Modern implant systems are generally available in one-piece and two-piece designs. One-piece implants combine the implant body and abutment into a single structure. While they simplify certain procedures, they offer limited restorative flexibility. Two-piece implant systems are far more common today. Because the implant and abutment are separate components, clinicians can correct angulation issues and achieve better prosthetic outcomes. These systems often include anti-rotational features such as internal hex or external hex connections that help maintain stability and precision. After the implant has healed successfully, attention shifts to the final restoration. Implant crowns can be either screw-retained or cement-retained. Screw-retained restorations offer the advantage of retrievability. If maintenance or repairs become necessary in the future, the restoration can be removed relatively easily. Cement-retained crowns often provide superior aesthetics, particularly in highly visible areas of the mouth. However, excess cement must be managed carefully because it can contribute to peri-implant inflammation and disease. One of the most fascinating concepts in implant dentistry is implant stability. Immediately after placement, implants rely on what we call primary stability. This is the mechanical stability achieved through the physical engagement of the implant with bone. As healing progresses, bone remodeling occurs, and stability may temporarily decrease. This period is often referred to as the stability dip. Eventually, new bone forms around the implant surface, creating secondary stability through biological integration. This biological stability is what ultimately determines long-term implant success. When placing implants, clinicians must also respect important anatomical safety zones. Adequate spacing between implants, adjacent teeth, nerves, and surrounding bone is essential for maintaining healthy tissues and preventing complications. Proper planning helps preserve aesthetics, support bone stability, and ensure long-term function. So how do we define implant success? A successful implant should be completely stable, free of pain, free of infection, and demonstrate healthy surrounding bone. Radiographs should show no evidence of pathology, and the patient should be able to function comfortably and confidently. On the other hand, mobility, progressive bone loss, peri-implantitis, or persistent discomfort may indicate implant failure and require intervention. As we conclude today's discussion, it's important to remember that successful implant dentistry is never accidental. It is a result of careful diagnosis, thorough treatment planning, surgical precision, biological understanding, and prosthetic excellence. Every stage of treatment contributes to the final outcome. Dental implants have transformed millions of lives around the world, and with continued advancements in digital dentistry, guided surgery, regenerative materials, and artificial intelligence, the future of implant therapy continues to evolve. Thank you for joining me on this episode of the DenTrends DenTalk podcast. For more clinical insights, dental technology updates, industry trends, and educational content, visit DenTrends.com. Until next time, keep learning, keep growing, and keep delivering exceptional patient care. Stay informed, stay inspired, stay ahead with DenTrends.